What is bladder cancer? Bladder cancer is a type of cancer that develops in the tissues of the bladder, an organ located in the pelvis that stores urine. It typically begins in the cells lining the inside of the bladder, urothelium, but can grow into deeper layers of the bladder wall and spread to other parts of the body in advanced stages. Types of bladder cancer. 1. Urothelial carcinoma, transitional cell carcinoma, TCC, the most common type, accounting for about 90% of bladder cancer cases. Originates in the urothelial cells that line the bladder. 2. Squamous cell carcinoma, often linked to chronic irritation or infection of the bladder. Less common, making up about 5% of cases. 3. Adenocarcinoma, rare, accounting for about 1 to 2% of cases. Develops in the glandular cells of the bladder. 4. Small cell carcinoma, a rare, aggressive form that starts in neuroendocrine cells. 5. Sarcoma, very rare, arising from the muscle or connective tissues of the bladder. Causes and risk factors. The exact cause of bladder cancer is not always known, but several risk factors increase the likelihood of developing it. 1. Tobacco use. Smoking is the leading risk factor, linked to about half of bladder cancer cases. Harmful chemicals in tobacco accumulate in the bladder. 2. Chemical exposure. Occupational exposure to industrial chemicals, such as dyes, paints, or solvents, increases risk. Workers in industries like rubber, leather, and textiles are at higher risk. 3. Chronic bladder irritation. Repeated urinary infections, bladder stones, or catheter use can increase risk. 4. Age and gender. Most common in people over 55, with men being 3 to 4 times more likely than women to develop bladder cancer. 5. Family history and genetics. A family history of bladder cancer or inherited genetic mutations can increase risk. 6. Radiation or chemotherapy. Prior pelvic radiation therapy or chemotherapy with cyclophosphamide can increase risk. 7. Parasitic infection. Infection with schistosoma hematobium, common in parts of Africa and the Middle East, is linked to squamous cell carcinoma. Symptoms of bladder cancer. The symptoms can vary depending on the stage and severity, but common signs include 1. Hematuria, blood in urine, most common early symptom. May appear as pink, red, or cola-colored urine or microscopic blood detected during a test. 2. Urinary symptoms. Frequent urination. Pain or burning during urination, dysuria. Feeling an urgent need to urinate. 3. Pelvic or back pain, typically seen in advanced stages. 4. Systemic symptoms, in advanced cases, fatigue, weight loss, swelling in the lower extremities. Diagnosis of bladder cancer. 1. Medical history and physical examination. Includes assessment of risk factors and symptoms. 2. Urine tests. Urinalysis. Checks for blood or abnormal cells in the urine. Urine cytology. Examines urine for cancer cells. Urine biomarkers. Tests for specific substances linked to bladder cancer. 3. Cystoscopy. A thin, lighted tube, cystoscope, is inserted through the urethra to view the bladder. Biopsies can be taken during this procedure. 4. Imaging tests. CT urography, or MRI, provides detailed images of the urinary tract. Ultrasound detects masses in the bladder. Intravenous pyelogram, IVP X-rays taken after injecting a contrast dye. 5. Biopsy. Tissue samples obtained during a cystoscopy are examined to confirm the diagnosis and determine the cancer type and grade. Stages of bladder cancer. Bladder cancer is staged based on the extent of spread. Stage 0. Cancer is confined to the inner lining of the bladder. Stage I. Cancer has spread to the connective tissue below the lining. Stage 2. Cancer has invaded the muscle layer of the bladder wall. Stage 3. Cancer has spread to surrounding tissues or organs. Stage 4. Cancer has metastasized to distant organs or lymph nodes. Treatment of bladder cancer. Treatment depends on the cancer type, stage, and overall health of the patient. 1. Surgical options. Transurethral resection of bladder tumor, TURBT. Common for early-stage cancers, involves removing tumors through the urethra. Partial cystectomy. Removes a portion of the bladder. Radical cystectomy removes the entire bladder, may include nearby lymph nodes and organs. 2. Intravesical therapy. Medication is directly delivered into the bladder. BCG therapy, a form of immunotherapy using a weakened bacterium to stimulate the immune response. Intravesical chemotherapy. Drugs like mitomycin are used to target cancer cells. 3. Systemic chemotherapy. Used for advanced or metastatic bladder cancer, often combined with other treatments. 4. Immunotherapy. Drugs like checkpoint inhibitors, e.g., atezolizumab, pembrolizumab, boost the immune system to attack cancer cells. 5. Radiation therapy. Targets and kills cancer cells using high-energy rays, often used when surgery isn't an option. Prognosis and outlook. The prognosis depends on the stage and grade of the cancer at diagnosis. Early-stage bladder cancer has a high survival rate, but it often recurs, requiring long-term monitoring. Advanced-stage bladder cancer has a poorer prognosis, but can still be managed with a combination of treatments. Regular follow-ups with imaging and cystoscopy are essential for detecting recurrence or progression.